Alright, now we're going to reintroduce about the notation in the daily use. The first, the sampling tube of the flow sensor. We need to keep it upside. If you turn it to the downside, there will be some waters in, so it will be influenced to the sensor. It's the wrong connection. Please make sure it's upside. Notice of the cooling fan. This cooling fan will have a filter inside and need to clean every 500 hours in the daily use of ICU room. And this dust filter, you just need to clean it in the water and dry it, then put it back to reset onto the machine. Notice of the air filter. Please pay attention to the air filter to keep it downside. Never put it upside. In this way, there will be linkage. It's not allowed. Please keep it downside. The cleaning and disinfection of the ventilator. During the daily use, we need to change the tubes of the disposables as we use to the different patients. The nebulizer tubes, the patient circuits, as well as the bacteria filter. These three things are totally disposable. They cannot be used for different patients. Okay, the next disposable part is the exhaust hose. This hose contains two parts, the metal connector and also the exhaust tube. For the tube, it is disposable. We need to take off the connector as you turn clockwise. And this one, we can use it for different patients after the disinfection. Exhalation valve. In this part, we need to take off the flow sensor probe first. And then take off the valve. First, press this button and turn upright of the PEEP valve and take it off. And then pick this diaphragm off. And then about the humidifier part, we need to take off the water tamper. You just press this blue button and then remove it easily. This is the humidifier part need to be cleaning and disinfection. In those parts, because we have different suppliers for this humidifier and the instructions is totally different. So we suggest the end user to check with the user manual and find out about the cleaning and disinfections. Please pay attention to this temperature probe. This metal connector of the exhausting hose. This diaphragm of the exhalation valve. Exhalation valve. Flow sensor probe. These totally 4 parts can be disinfections autoclavable and in high temperature and high pressure. This flow sensor probe, please pay attention to the tubes that the flow sensor sampling tube can be also clavable in higher pressure and high temperature. And pay attention to the probe inside. It cannot be flow with water or other high pressure. If inside any damage, it cannot be used normally. After the cleaning and the disinfection, we need to reassemble this probe and valves. Firstly, install the exhalation valve diaphragm. This diaphragm needs to be installed in this groove with the metal side inside. In this metal side inside of the machine. You put it inside and press the edge. And then we press this exhalation valve and turn it uprightwards. And then finally, we connect this flow sensor probe. Keep this sampling tube upside and follow the instruction. The blue one connect to the blue and the white one connect to the black arrow. After the disinfection, we need to pay attention to the connection of the metal connector to this exhaust hose. Please make sure you are turning it in the anti-clockwise to install. And see here the narrow side and the wider side. Keep the narrow side near to the main unit and connect to the exhaust port.